Welcome to my page. My name is Dr. Maxilo, and I'm going to be taking you on the topic titled Media Nerves. Please, if you find this video very interesting, all you have to do is to help me subscribe to this channel, drop a comment. If you benefit from the video, drop a comment, and please share this video to your friends who need it more. Please. It will help me. It will also help me improve in producing quality content with your suggestion and your opinion. Please drop a comment. It will help me a lot. And now, a lot of comment. I received a lot of message from different preclinical students about the topic anatomy, and a lot of them felt, maybe a lot of them felt that the anatomy is a very hard thing to understand. A lot of them had that phobia. So I'm here to clarify all those questions. I'm here to create videos for just for you people so you can understand what anatomy is, and it's something that you don't have to cram. Anatomy is not something you have to cram. You just have to see it the way it is and say it the way it is. It's as simple as that. Okay, so it's not a hard thing to understand. It's as simple as that. Say it the way you see it and you get your mark, not something you cram, because if you cram it, you will forget. Okay, please don't forget to subscribe to the channel. So I'm going to be talking about the media nerves. I will have started from the introduction, but let me just go straight to this because all the comments and the message I've been receiving, they say they're having issues in how to write on media nerves, bones, and muscles. I'll still talk about that aspect, but let me focus on this question they are throwing at me right now. So before I start, please don't forget to subscribe to the channel. It will help me more. Thank you. So what is a media nerve? But before I start about the media nerve, let me give you the synopsis, how you are supposed to write on nerves. How you are supposed to write on nerve is very important. You have to write on this like this way. This is the way you are supposed to write your question. If they ask you in an exam, what is a media nerve? What are you supposed to write? Number one, you are supposed to introduce it. Introduce your nerves. Anatomically, introduce your nerves. As simple as that. Don't go and be writing jargon. Introduce it the way it is. Don't manufacture anything from anywhere. Introduce it. You don't have to cram it. Introduce it. Secondly, the root value. A lot of people will forget about the root value. It's normal. Many people forget the root value, but that can really give you a lot of mark. Like if you're trying to write on that particular on this topic, the root value. I repeat, the root value of that nerve. Then you go further, talk about the origin of that nerve. I'm giving what you're supposed to write on the nerve. The origin. After you're talking about the origin, go further, talk about the cause, how it is moving, where it is coming from, where it is going. You talk about that. After that, then you can now talk about the branches. Talk about the branches. After you finish talking about the branches, you can now talk about the relation of that nerve. After you talking about that, now at the last but not the least, you talk about what? The clinical correlation or the clinical benefits or clinical importance or clinical significance. They all mean the same thing. You put it that way. And that is how you write on nerve. So let me start by what is a nerve? What is media nerve? So this is not cramming. I'm bringing it from my head the way it's supposed to be. So now I can picture what the media nerve is. Where is it coming from? Let me introduce it that way. So I can say a media nerve is formed by the lateral cord and the medial cord of the brachial plexus, and it's also known as a the eye of the hand or labral nerve or maybe dollar nerve. I can introduce it like that, something like that. And it is one of the major nerves of the upper extremities. As simple as that. I can just introduce it like that because that's what I'm saying. So I'm not cramming it, I'm saying it. Then secondly, talk about the root value. Since it is coming from the lateral cord and the medial cord of the brachial plexus, so the root value will be from all the root value of the brachial plexus. So what are the root value? C5, I repeat, C5, and towards C7 and C8 to T1. So you can say C5 to C8 and T1. The reason why I separated it the other way was because one is coming from the word the media and one is coming from the word the lateral. That is the reason why I separated it to what C7, C5 to C7 and C8 and T1. Because of one set is coming from the one root and one chord, one set is coming from other chord, from the other chord. But it's as simple as that. Then now talk about that's the root value. Now talk about the cause of this nerve. So you can just put it like this. The medial nerve is coming from where it is formed. You can put it anyway. It's coming from where it is formed from the what the formation of the from the medial and the lateral cord of the brachial plexus in the axilla, and it courses downward. That means it moves downward where it is what it is lateral to the what the brachial artery in the upper part of the arm. Then when it curves downward in the middle part of the arm, it will now move medial to the what brachial artery. Then when it gets to the inferior part of the arm, it will still be what the medial part. It will now still be medial to the what brachial artery. Then when it gets to the cubital fossa, where is the cubital fossa? Your cubital fossa is what is a depression in the anterior part of the anterior part of the between the what the arm and the what between the arm and the forearm. So it is an anterior depression of the elbow joint. That is where the cubital fossa is. So you can put it like that. Then it will now go downward where it passes between the flexus the digitorum superficialis and flexor digitorum profundus. So it is like this. The flexor digitorum superficialis is on top. So it will pass between what the flexor the digitorum superficialis and flexor digitorum profundus. So it will move like this. The nerve will be in the middle. It will move between those two muscles. So superficialis, flexor digitorum superficialis and flexor digitorum profundus in the what in the hand. But it will pass through what when it gets it try to when it's existing from the on the arm, it will pass through what pronator teres muscles, the two head of the pronator teres, before it will now get to that before it now pass through those two muscles I mentioned earlier. Then it will move downward where it will now be crossed by what the ulnar artery, because the brachial artery will definitely give two branches, the ulnar artery and the what radial artery. Then it will now move down. It will be explained that way. It will now move down where it will now pass through deep to the what to the flexus retinaculum. So what is the flexus retinaculum? The flexus retinaculum is simply a fibrous connective tissue band. So it's like this. It will move like this, like it's something like a band, like you use a band to band something. So how do I explain it? So imagine this is your paper. Let me explain it at least. This is your paper. This is a band. So it will be like this. That is a flexor retinaculum. So the muscle the nerve will move in under. It will move deep to the what the flexus retinaculum, where it will now give two branches. To give what a you have to check your hand when you're explaining so I will not make mistake. To the what the lateral division and what the medial division. It will give those two branches where we will explain when it comes to the branches. That is just the height is moved. That's the cause. Then you can decide to talk about the branches, the branches, or maybe you can talk about the relation. But let's talk about the branches. So in the upper part of the arm, it will give two branches. It will give what? It will give a vascular branch. They'll give that to brachial artery. and they also give a muscular branch in the, yeah. Then when it gets to the cubital fossa, it will give branches like flexors, carpa radialis, flexor digitorum superficialis, I think palmaris longus. It will not give, so it will give three branches, about three branches, muscular branches in the cubital fossa. So you go and read it up and try to find out more about how it is. But I'm giving an overview what you need to know. Then when you get to the hand, I mean to the forearm, it will supply a muscle like lateral part. So you take note of it. It's not supplying just the flexor digitorum profundus. It's not supplying all the flexor digitorum profundus. So it is supplying just the lateral part. Note, it is supplying just the lateral part of flexors digitorum profundus. You understand? So it's not the media, it's the lateral part. So an MCQ question can ask like dash, or let me just say they can put an option. The medial nerve supply A, the lateral part of the flexor digitorum profundus. B, the medial part of the flexor profundus. The answer is the lateral part of the what? Flexor digitorum profundus. Take note of that. Then when it gets to the hand, now give it two branches. Example, the lateral branch, the lateral branch and the medial branch. So look at how it is. Anything like this is the medial, anything like this is the what? Lateral. So after that, it will now give a medial branch. That means like it's going like this. That's why it's the medial branch. Then the lateral part, it will now give a recurrent branch. It will now give a recurrent branch. That means the recurrent branch, and also supply the interdigital clefts, the second and the third interdigital cleft of the finger. Then in the arm, I skipped something. The arm is going to give you one of the largest branch. That is the anterior interosseous nerve that will supply those flexors digitorum profundus, the lateral part of flexors digitorum. So it will supply by the largest branch. That is the anterior interosseous nerve will supply those ones. So it's as simple as that. So what I want from you is that while I've given an overview, you have to go back, sit down and look at it. It will help you because now I'm breaking it down so that when you read it, you appreciate it more. Then not just that. Now the clinical significance, there's a lot of clinical significance you can find. So open your textbook, because I prefer that different schools they have their textbook and they will definitely set it from their textbook that they have. So read your textbook, but this is an overview of what you are supposed to know. These are what you are supposed to write on it. I've given you the synopsis of what you need to know. Then the clinical significance. The clinical significance, one of the major clinical significance is what? The carpal tunnel syndrome. So once you write that, you can decide to write on carpal tunnel syndrome and you have gotten your mark because that's a clinical significance. I know since there is a nerve and there's anything that injures the nerves, it definitely cause paralysis to some, like let me just say it will cause weakness to some muscles. That's a clinical significance. But one of the major clinical significance is carpal tunnel syndrome. Because it will try to pass the carpal tunnel. And the carpal tunnel is formed by about 9 tendons. Still the flexors digitorum profundus and other muscles. So one of the clinical significance is carpal tunnel syndrome. So you need to look at those things, and the muscle, the nerves is innervating. I'll put the, now let me say something. The recurrent branch will supply this to the thenar part. We have the thenar and the hypothenar eminence. Thenar and hypothenar. See, thenar, hypothenar eminence. So the recurrent branch of the lateral division of the medial nerve, we what? We supply the what? The thinner part. Then other branch will now go to the what? Supply side of the index finger. But the medial part will go and what? We go like this. That is the supply here and here. And this one will go like this and supply here. So that it will go like this. Look at it's two like this. They are of the medial part. You go like this. You enter here and divide and do like this and do like this and supply. You understand? So that's how it will. Then when you talk about the clinicals, check those things that those what happened to a nerve here, what will happen, which muscle will it affect. So you need to look at those things when you are looking at your um this particular topic. It will help you a lot in understanding what you need to know. Thank you so much. Please don't forget to subscribe. I will drop more videos on different nerves and tell you what you need to know. Then at the end of this video, this video, I will do an MCQ on this topic. So after you've watched this video, go through your textbook and see whether you understand why you are reading it. Then at the end of it, I will drop a video on the MCQs on only the medial nerve. So get ready. If you fail this MCQ, I think you didn't watch this video well, because I'm definitely going to set from what I just said, and it's going to be standard MCQ. So please don't forget to share, like, and subscribe to my channel. Thank you. You're welcome.